The role of standardized plant extracts in controlling alcohol withdrawal syndrome, an experimental study. This is published in Brain Sciences, published online July 12, 2021, in the National Library of Medicine, National Institute of Health. Authors were Isol Haig, Akhilesh Mishra, Bhupinder Singh Kara, and Shalini Chala. Chitra Manjam is the academic editor. Abstract. Patients with alcohol use disorder experience alcohol withdrawal syndrome due to the sudden cessation of alcohol. This study was designed to evaluate the protective effect of ashwagandha and brahmi on alcohol withdrawal in rats. 30 rats of either sex were taken and randomly divided into 6 groups. Their normal diet was replaced by a modified liquid diet. Ethanol was added gradually, except in the MLD group, for a period of 21 days and withdrawn suddenly. 4 treatment groups were administered ashwagandha and brahmi orally, and diazepam 45 minutes before alcohol withdrawal. Rats were assessed for behavioral changes, agitation score and stereotypic behavior, anxiety and locomotor activity in 2nd and 6th hours of alcohol withdrawal. PTZ, pentyletrazole, kindling seizures, was assessed at 6th hour of alcohol withdrawal. Ashwagandha and brahmi alone and in combination significantly reduced the behavioral changes in alcohol withdrawal rats at 2nd hour and their combination in 6th hour. Ashwagandha and brahmi suppressed PTZ kindling seizures effectively and improved locomotory activity at 2nd hour and 6th hour of alcohol withdrawal. Reduction in anxiety was significant among ashwagandha at 2nd hour and the combination group at 2nd and 6th hour. The results were comparable to diazepam. Ashwagandha and brahmi have beneficial effects in controlling the behavioral changes, anxiety, and seizures in alcohol withdrawal symptoms in rats, and improved locomotory activity. 1. Introduction. Alcohol, ethanol or ethyl alcohol, is a commonly used psychoactive substance for dependence-producing properties. Globally, alcohol use disorder, AUD, is a major health problem and is associated with social, mental, physical, and legal consequences. It is generally associated with cravings, tolerance, and withdrawal symptoms upon cessation. Alcohol withdrawal syndrome, AWS, is a well-known condition occurring after intentionally or unintentionally abrupt cessation of heavy or chronic drinking, and it occurs in about 8% of hospitalized AUD inpatients. AWS is characterized by tremors, anxiety, sweating, nausea, and tachycardia, and in severe cases may involve hallucinations, seizures, and delirium tremens. Untreated alcohol withdrawal syndrome can be fatal. Alcohol is a central nervous system depressant that produces euphoria and behavioral excitation at low blood concentrations due to increased glutamate binding at the N-methyl-D-aspartame NMDA receptors. At higher concentrations, it leads to acute intoxication by potentiation of the GABA effects. Prolonged alcohol use leads to the development of tolerance and physical dependence, which may result from compensatory functional changes by down-regulation of GABA receptors and increased expression of NMDA receptors. Abrupt cessation of chronic alcohol consumption unmasks these changes with a glutamate-mediated CNS excitation, resulting in autonomic overactivity and neuropsychiatric complications, such as delirium and seizures. Thus, patients experiencing alcohol withdrawal have decreased GABAergic functioning and increased glutamatergic action through the central nervous system. Management for any patient with suspected alcohol withdrawal is initial resuscitation and rehydration. Benzodiazepines, BZD, are the first-line pharmacological agent for treating alcohol withdrawal syndrome. The benzodiazepines most used for this purpose are lorazepam, chlordiazepam, oxazepam, and diazepam. They act as central GABA-A agonists, increasing the frequency of GABA receptor channel opening, leading to more influx of chloride ions and providing an inhibitory effect, which is similar to that of ethanol. BZDs are associated with potentially life-threatening side effects, including the risk of dependency and withdrawal symptoms, increased risks of falls, and respiratory failure. In addition, psychological side effects, cognitive impairments, depressive mood, and sleep disorders have been described, as well as increased impulsivity that could lead to suicidal behaviors. In view of the available literature, there is a need for better and safer pharmacological agents for managing alcohol withdrawal syndrome. Withania somnifera, commonly known as ashwagandha, has been used for centuries in Ayurvedic medicine to increase longevity and vitality. Various preclinical studies have shown that ashwagandha has anticonvulsant, antidepressant, anti-anxiety, hepatoprotective effects, etc. Ashwagandha preparations have been found to have a potential therapeutic role in almost every CNS-related disorder. Glucocorticoids, withaferin A, and cytoinsatides isolated from ashwagandha significantly reversed ibotenic acid-induced cognitive defects in Alzheimer's disease model. Another study demonstrated that chronic oral administration of withanoside attenuated with axonal, dendritic, and synaptic losses and memory deficits induced by amyloid peptide in mice, and it can modulate GABAergic, cholinergic, and oxidative systems in the central nervous system. Bocapa monera, commonly known as Brahmi, is a neotropic plant in Ayurveda and has been studied widely for its cognition-enhancing, antidepressant, anti-hypertensive, anti-asthmatic, anti-ulcer, analgesic, neuroprotective, hepatoprotective, and nephroprotective properties. Bacoside A is a major chemical entity responsible for Brahmi's well-known nootropic effect, as well as other neuromodulatory, hepatoprotective, and antioxidant activities. Few preclinical studies have shown that Brahmi treatment potentiates a therapeutic effect by reversing the alterations in GABA and GABA-A receptor binding that occur during epilepsy, resulting in increased GABA-mediated inhibition in the overstimulated cerebral cortex neurons. Another study showed improvement in spatial learning performance and enhanced memory retention in rats treated with Brahmi extract, clearly indicating that exposure to Brahmi improves learning and memory. Brahmi also showed strong and dose-dependent antidepressant effects in different mice models. Another study in epileptic rat model concluded that bromine potentiates a therapeutic effect by reversing the alterations in general GABA, GABA A, GABA B receptor binding, GABA A receptor subunits, GAD and CREB gene expression that occurs during epilepsy, resulting in an increased GABA-mediated inhibition in the overstimulated cerebral cortex neurons. In preclinical studies, animals exhibit alcohol abstinence symptoms like those observed in humans. The anxiety and depressive-like behavior in rodent models mimics human dysphoric emotion related to alcohol abstinence and may aid in testing the therapeutic potential of promising agents for alcoholism. In most of the studies, a modified liquid diet model of chronic ethanol administration was used. A study was done to validate the modified liquid diet model of chronic ethanol administration. They concluded that it may be used as a valid means to investigate ethanol abuse and dependence in an experimental context and can be used to assess the pharmacological profile of drugs on alcohol withdrawal syndrome in rats. Ashwagandha and brahmi, with their GABA agonist activity, may have the potential to control alcohol withdrawal symptoms. The objective of the study was to study and compare the effect of ashwagandha and brahmi individually and their combination with diazepam on alcohol withdrawal syndrome in rats. Discussion. Alcohol abuse is a major health problem in our society. One of the features of chronic alcohol intake is the development of physical dependence, resulting in physical withdrawal reactions after cessation of alcohol. Alcohol withdrawal includes symptoms such as neural excitation, seizures, disorientation, anxiety, and agitation. Long-term exposure to alcohol causes adaptive changes in several neurotransmitter systems, especially gamma-aminobutyric acid, GABA receptors, and glutamate receptors. GABA plays a key role in neurochemical mechanisms on the basis of intoxication, tolerance, and withdrawal. Repeated exposure to alcohol reduces GABA hyperpolarization, resulting in reduced neural inhibition. Benzodiazepines like diazepam, chlorodiazepazide, etc. are the recommended drugs for the treatment of alcohol withdrawal symptoms because they ameliorate both the anxiety and seizures. They depress CNS excitation by GABA agonism. However, they have potential for causing dependence and leads to abuse. Benzodiazepines also possess serious adverse effects like respiratory failure and delirium. Ashwagandha and brahmi are commonly studied herbs in various CNS disorders, including anxiety and seizures. Both of these have shown significant GABA agonist activity in few preclinical studies. In our study, we observed an improvement in the behavioral activity of rats with alcohol withdrawal in diazepam, ashwagandha, brahmi, and ashwagandha and brahmi treated groups. In elevated plus maize EPM, we observed an anxiolytic effect in alcohol withdrawal rats when treated with ashwagandha, brahmi, ashwagandha and brahmi, and diazepam. The administration of test drugs resulted in first entry of majority of rats into the open arm. In addition, the number of entries into open arms were higher in ashwagandha, brahmi, and ashwagandha and brahmi groups compared with the untreated ethanol group. However, none of these anxiolytic effects were statistically significant when analyzed. Previous reports based on the EPM test suggest that withdrawal of ethanol following chronic treatment generates anxiety, which is a measure of psychological dependence. The present studies confirm these by showing a significant reduction in openorm entries in the MLD and ethanol group at 2nd and 6 hours of alcohol withdrawal. In addition, in a previous study, ashwagandha showed a significant anxiolytic effect in alcohol withdrawal rats at 8 p.m. at 100, 200, and 500 milligram per oral dose. In the open field test, alcohol withdrawal resulted in reduced locomotor activity in the 2nd and 6th hours. The reduction in exploratory behavior, often referred to as withdrawal anxiety, was observed by the decrease in the number of line crossing activity. When treated with diazepam, rats showed a significant increase in the number of lines crossing. Rats treated with ashwagandha brahmi and ashwagandha and brahmi also showed an increase in locomotor activity. In a previous study, ashwagandha 500 milligrams oral showed a significant increase in locomotor activity in the open field at 6 hours of alcohol withdrawal. Mishra and others also reported that rats treated with ashwagandha and brahmi were effective in controlling agitation and seizures and showed similar results. Previous studies showed a persistent reduction in the seizure threshold in rats on chronic ethanol administration. In this study, ashwagandha, brahmi, and their combination have suppressed PTZ kindling seizures in alcohol withdrawal rats, similar to diazepam. In the previous study, ashwagandha at higher dose suppressed seizures in a similar manner, whereas ashwagandha at lower dose did not suppress seizures at same level. The findings in our study show that both ashwagandha and brahmi can have similar GABA agonist activities, comparable to benzodiazepines, which offer significant protection against convulsions in alcohol withdrawal syndrome. Conclusion: alcohol withdrawal syndrome is a common manifestation in alcohol dependence due to the imbalance of GABA and NMDA homeostasis in CNS caused by chronic alcohol intake. Similar to diazepam, ashwagandha and brahmi individually and combination significantly reduce the behavioral activity, PTZ kindling seizures, and increase the locomotor activity in alcohol withdrawal rats. Further studies at different doses of ashwagandha and brahmi can be explored to evaluate their association with alcohol withdrawal syndrome.